One of the toughest aspects of battling opioid use disorder is overcoming the stigma attached to it. Shatterproof, a nonprofit dedicated to erasing negative attitudes that don't help with the problem, has partnered with the American Hospital Association to develop materials for clinicians to tackle the stigma of opioid use disorder. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Senior Writer for AHA. In today's episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, sits down with Matt Stefanko of Shatterproof to discuss how his organization has implemented a comprehensive suite of tools to combat stigma associated with substance use disorder, and why, despite the resources committed to it, there is so much more needed, especially in the time of COVID-19.
Thanks, Tom. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance, and today I'm joined by Matthew Stefanko, Director of the National Stigma Initiative for Shatterproof. And we're going to talk about how to address the stigma of opioid use disorder. So just to get us started, Matt, can you tell me a little bit about yourself and your role?
Of course, and thanks for having me join today. Shatterproof was founded a little less than a decade ago by Gary Mendel, our CEO and founder. Shatterproof, like many nonprofits, especially in the addiction space, was founded out of loss. Gary lost his son, Brian, after fighting and battling with a substance use disorder for many years. And out of that, wanted to develop a national nonprofit that could work to improve treatment quality, address stigma, and really act as a national leader to combat the opioid epidemic. And we really saw a void in the space to be doing that. Certainly, many governmental groups and certainly other nonprofits were spending time on the opioid epidemic, but the level of attention that we felt was necessary to address the addiction crisis specifically was missing or needed additional support. And that's really where Shatterproof began. And over the last 7 or 8 years, Shatterproof has evolved from a nonprofit that focused primarily on policymaking and putting on a series of annual events to really delving into quality treatment. And then within the last year and a half or 2 years, starting to focus on stigma, which is something that we had been doing on the side, but we didn't have the same level of clarity or focus that we do on it now. And we think that's one of the reasons why this effort is so distinct relative to other efforts and why we think it'll be so successful.
And I know your website, shatterproof.org, has a wealth of information and resources related to stigma across the spectrum of addressing opioid use disorder and substance use disorder. Can you talk a little bit about some of the resources and the specific services that Shatterproof is offering?
There's a number of different resources depending on where you come at this issue or how you need help or how you want to provide help. And so I'll try to discuss a few of those today. So first of all, if you're somebody who is seeking treatment or wants to help a loved one find treatment, Shatterproof recently launched treatmentatlas.org, which is a treatment locator and assessment system that is all online and can help navigate individuals to certain types of treatment that might be right for them. It certainly doesn't take the place of a medical examination or advice from a trained physician, but it can provide hopefully an interim step for folks beyond the simple sort of Google search that I think many people find themselves using. In addition to treatmentatlas.org, Lisa, like you shared, we're really excited about the wealth of information that we recently put on the shatterproof.org website related to stigma reduction. And one of the reasons we wanted to take our white paper, which was released in June, and we wanted to simplify it on the website. And we wanted to create something that was accessible and that moved beyond what we think many websites do when discussing stigma. And so frequently I've found in the space that stigma is sort of a throw-in at the end. Whatever an organization is focused on when it comes to the opioid crisis, at the end of it, they'll say, we need a page on stigma. They'll throw on some language potentially that folks should use or not use. They'll say that stigma is a bad thing and that it needs to be addressed, and they'll leave it at that. We wanted to go a step further and really provide resources that we thought would be useful to individuals as they better understood what stigma was and how to reduce it. And so Our website focuses on a few things. Certainly, we try to delve into the various types of stigma that exist, and everything from public stigma to self-stigma to structural stigma. I think when many people think about stigma, they think about the public stigma. They think about the communities and how communities might castigate or look at individuals differently who have a substance use disorder. And we wanted to take a little bit of a different approach and broaden that and really try to explain how individuals with a substance use disorder are working against many things that are working against them, right? So hospital systems potentially not having providers who understand their issue or want to treat them with respect and dignity. That's certainly a problem with their community or their employer not wanting to support them when they want to seek treatment or are seeking treatment. And then, of course, their family members and even themselves, right? The internalized feelings of shame and social isolation that come with addiction oftentimes creep into an individual's mindset as well. And so that can result in self-stigma. So we certainly talk about those resources, and we talk about those in the context of our white paper and also on the website itself. And then we also have additional resources related to language change, including a language guide, which will be released. And we're really excited about those resources, which we believe will help people learn what to say and what not to say in the context of a substance use disorder. And then finally, we have the Shatterproof Pledge, which is a existing resource on the site that can be distributed across your organization, within your family, or any other community that you see fit. And that's a great way to both indicate that you want to be part of the solution, but also to get involved with the Shatterproof Initiative broadly. And there's many ways to do that within the Stigma Initiative. And of course, we're in the business of sort of creating customized solutions or curating responses to organizations when they need help reducing stigma, wherever that may be. And so you can always reach out to us at endstigma@shatterproof.org, and we'll respond very quickly to anything that you might need or questions that you might have related to the website or the Stigma Initiative as a whole.
That's a great overview. And I know the AHA has recently joined with Shatterproof as a coalition member specifically on this issue of addressing stigma. And I think you captured it. It isn't just one thing. It's so many different ways and places that we don't even realize how we use language and so forth. And I know we're talking about various resources we can release together, but thank you for all your work on that. Especially now in the time of COVID and the numbers we're starting to see around increasing rates of opioid use disorder, increasing deaths of despair, there's even more work to be done. The upheaval across the world, all of this impact that the pandemic and social isolation has had, addressing stigma today, I think, is even more important than it was even 6-8 months ago. Talk to me a little bit about what do we know now in terms of how we can reduce some of these stigma, and where do we need more research to really be able to dig in and reduce stigma to be able to help those with opioid use disorder?
It's been a really fascinating and obviously I think for many people who have been in the space a frustrating time, because for so many of us over the last 3 or 4 years, and for individuals who have been working in the space for decades, we began to see the tides turning. We saw overdose numbers decreasing. We were getting a control over how to address a lot of these issues on the ground and in communities. And I think COVID has, we know from the data already, stalled that progress, if not, and most likely is making it worse. And so I think what we know is that this is going to be a problem, continuing to be a problem for many, many years. And we need to think about how we're going to continue to address some of the key drivers and root causes of the addiction crisis and the opioid epidemic more specifically. And we certainly understand stigma to be one of those most important drivers. When we conducted the work that ultimately led into the white paper that we released, we looked across what we felt were the 9 key drivers of the opioid epidemic. You could make it 8 or make it 10. We believe it's 9. And out of those 9, we found that 7 of the 9 were either partially or entirely driven by stigma. And that means that as we're moving forward and as COVID continues to overlap and interact with individuals who have substance use disorders, it's more important than ever before to address the stigma that's often associated with it. And I think within the context of COVID, the fear is certainly that many of the components that we know to be true about stigma, right? Whether it be individuals feeling socially isolated or feeling shame or like they're not part of a community, feeling like their providers are not spending enough time with them or understanding where they're coming from. Those are only going to get exacerbated by COVID-19. And this isn't due to any fault of a provider who obviously in this context is overwhelmed, dealing with their own mental health issues, I'm sure. But it's especially important for us to really double down on those efforts and say, now is not the time to stop paying attention to the individuals coming into your health system or your treatment program who have a substance use disorder. It's actually more important now that you're spending time with them, respecting them, offering the dignity that we know they deserve. And certainly then when it comes to individuals, making sure that they know that they are a part of the community, that they do not need to feel shame because of their substance use disorder. They do not need to feel isolated or feel that shame, like I said, if they have a recurrence of their substance use disorder due to the stressful time of the pandemic. So there's a lot of urgency now that has always been a topic that obviously is urgent, but we had started to fall into a steady state of really addressing and turning the tide, and I'm not sure if that's the case anymore. And so I think many of us who have been working in this over the last few years are trying to tap into the urgency that we felt or people in the community felt in 2015 or 2016 when overdoses were really peaking. And we're fearful that that could happen again, and we're trying to take the same steps that we were forced to take then and take them now.
Yeah, and I think there are certainly a number of factors that are feeding into this from, as you said, the social isolation and all those challenges. And then the fear that we see of the general public returning to hospitals and health systems and to care in general, and the concern about the potential to get sick. They stop socially isolating. So I think it is a little bit of a catch-22. Yeah. You talked a little bit, and I'd like you to expand on some of the things that hospitals and health systems and the community health centers and others that they work with, really the whole broad health system can start doing or amplify to really reduce that stigma and support their communities.
There's a range of things that we think folks can do within those systems that range from extensive and that require a significant amount of work and time to small things and small adjustments and changes that can be made. Certainly on the more expansive end, training and further education, whether that be in person or digital, can be critical. One of the pieces of technology that we've been advocating for is a tool that recently was released from the University of Texas at Austin's Dell Medical School called Reducing Stigma Education Tools, or RESET. It's a 90-minute module that provides continuing medical education credit, and we think provides one of the most robust digital solutions or digital efforts or trainings targeted at physicians and just providers more broadly that we think is really useful. Certainly, if you can take that digital training and supplement it with conversations within the context or the walls of your hospital system or your health center where you're actually having conversations or figuring out how to create engagement opportunities between individuals with substance use disorders and those without, we know that in the field of stigma reduction called a contact-based strategy is one of the most effective ways to reduce stigma, especially if it can be done in person. And I think from my perspective, from what we've seen that's been really effective is certainly trying to showcase and find opportunities for physicians or providers to have opportunities to engage with individuals with substance use disorders, not at their lowest moments, but at all the other moments in their life and through their treatment journey. And I think so many physicians or providers are often seeing people in times of crisis, and that's the primary time that they're seeing that individual. And I think anybody at their lowest moment or a time of crisis may not be somebody that individuals want to be around or that physicians necessarily have positive feelings towards, but it's important to be able to showcase situations and scenarios where we're demonstrating individuals with substance use disorders with a range of life situations, just like all of us have. I think that's so important and certainly interesting to do. When it comes to Shatterproof, we have a number of resources that are off the shelf that we're happy to work with organizations to implement. We have Just 5, which is our high-level training on addiction that dispels myths and certainly has a component to discuss stigma. 6 lessons, 5 minutes apiece. We find it to be a really easy way for organizations to provide digital training to all of their employees, in addition to Reset, like I mentioned earlier. And then, of course, we have a number of resources related to language, whether it be our language guide, our Words Matter video lesson, which is about 2 minutes long and provides an overview of the language that individuals should be using when discussing or speaking with folks who may have a substance use disorder. And so language change, education, and then looking at policies internally are an important component of how you can address stigma within the context of your health system.
Absolutely. And I know part of this podcast series that we're continuing today, one of our earlier ones was with Rich Botner talking about the Reset module. So links for those are also available at aha.org. And links to all of these materials are available from there out to these websites. To wrap us up, what would be, one or two pieces of advice that you might share with the field, or even, if you could go back in time, share with yourself, say 3 or 4 years ago, about this work and how to really think about addressing stigma?
Yeah, it's a great question. Typically, I'm asked that question or deal with that question when folks are asking, what they can do, or they're trying to understand where they took a misstep or did something that was stigmatizing. And typically, I'll try to approach it by just asking the question of, would you want to be treated, or would you want a loved one of yours to be treated or spoken to in this way that either your community or you or your employer, et cetera, may have been treating that individual? And I think most of the time, the answer that I'll get from that question is no. And I think it's really important to be thinking about that when addressing individuals with a substance use disorder, whether it be in the context of your health system or your employer or any other place. We know that there are so many things, especially with COVID-19 and the stress and mental health issues that are facing our country, that it's so easy for this to happen to so many people. And that if it were to happen to you, if it were to happen to a loved one, you would want your community and you would want your health system and you would want the employment system to be supportive of that individual getting into recovery or to being in a better place physically, mentally, and emotionally. And so that's certainly something that I'm always reminding myself when designing interventions or thinking about how to address folks with a substance use disorder. So I think it's really important. And I also think it's really important to just step back and to just remember that these folks are people just like anybody else. And we know from the research that that's such an important message. And it sounds so obvious, but it's really important. I think within the context of the health system or the health ecosystem, we so often have conversations about an individual with a substance use disorder only within the context of their substance use disorder, not as John or Mary or Joe or whoever else it may be. It's always patient or person presenting with X issue or Y issue. And so I would really encourage people to be reminding themselves of that as much as we believe that there are science-backed and evidence-based interventions that are so important to initiate to reduce stigma, it's also important to remember that at the end of the day, these are human beings and they need to be treated with respect and dignity, regardless of the situation that they're facing with their substance use disorder.
Absolutely. I think that is a great take-home message. We certainly need, especially in these times, to have as much compassion as possible for everyone we encounter. Thank you so much, Matt, for joining us, and thank you for the work that you do at Shatterproof.
Of course. Thank you for having me.